Okay. All right.
Hi, everyone. This is Kate with Scottsdale Moms, and today I am joined by Dr. Franklin. Dr. Franklin, thank you so much for being here.
Hi, Kate. Thanks for having me.
Thank you. Well, I would love for you to just let our moms know a little bit about you, how long you've been in Phoenix and what your specialty is.
Yeah, so I have been in Phoenix just about 3 years. It'll be 3 years in September of this year, 2021. I came here after spending the majority of my career in Houston, Texas, at Texas Children's and Baylor College of Medicine, where I was working with their adult congenital program and helped put their program on the map. And then, Phoenix Children's came calling in 2018, and I decided to pack up and move the family and the kids and the wife out here, and it's been great. We've had a great transition, a great time ever since.
Oh, good. Yeah, I love Phoenix. I am a Texas girl also, so I completely relate to moving from Texas to Phoenix, and likewise, it was a good transition.
Yeah, there's a lot of similarities, the weather, some good people, but yeah, they asked me to come out here and help run the Phoenix Children's Heart Center. So I work closely with a lot of great people here, fortunately, and hopefully we're making good progress in that direction.
That's amazing. That's amazing. Well, thanks for taking the time to be with us. So I'm going to go down our questions if that's okay with you.
Sure, my pleasure.
So the first thing our moms really want to know is, what can I do before becoming pregnant?
Well, I think, it depends. If you don't have pre-existing heart disease, certainly just follow up with your doctor and just kind of get checked out. Let your doctor know any symptoms you may have. It's really good for women to have at least their annual exam, pap smear, physical exam as well. And then for those women who have so-called pre-existing heart disease, either congenital, which is a lot of the patients that I take care of, which is heart disease that they were born with, and oftentimes they get it repaired in childhood, and now they're grown-ups and women and becoming pregnant, or acquired, which is more like heart attacks and cholesterol and things like that. So about 3/4 of the heart disease during pregnancy is actually congenital, so certain conditions that are present from birth. So if in that situation, definitely want to go see your doctor, you want to go see your cardiologist, maybe you come see me and my team, because we actually have a whole set way of evaluating women who are so-called preconception before pregnancy, and then we follow them closely during pregnancy as well.
That's great. That's great to know. How often do I need to see my ACHD doctor when I am pregnant?
So for those women who have ACHD, which is an abbreviation for adult congenital heart disease, we like to see our patients once a trimester. So you know how it is. A lot of times women may not even know they're pregnant for the first or two. So that kind of gets you deep in the first trimester, sometimes in that first 13 weeks. And then we like to see them during the second trimester, right around 20 weeks, right in kind of the middle. Pregnancy is 40 weeks. So right in the middle is about 20 weeks. And then we see them towards the end of the pregnancy, but really at the beginning of the third trimester, which is right around weeks 28 to 30. So we kind of have some times where we do it in a standard fashion. We do some testing. We will often check mom's heart during the pregnancy with an echo, a cardiac ultrasound. And we can even now check the baby's heart with which is called a fetal echocardiogram. So echocardiogram of the fetus in the womb, because sometimes there's a connection there, and about 8 to 10% of women who have existing congenital heart disease have fetuses and children with heart disease, and we can diagnose quite a few of those diseases in the womb.
That's incredible. That's amazing what we can do now.
Yeah, imaging has gotten really, really good, even doing 3D reconstruction. I mean, a lot of women will get the sonogram and see the cute the picture of the baby's face. But we can also see the heart in very great detail, and we're happy to be able to provide that too.
That's amazing. That's amazing. So for those moms that are, walking a journey of pregnancy that do have ACHD, what are the chances that their kiddos would be born with CHD?
Well, so we have good studies of that. When the mom has congenital heart disease, the studies really show about 8 to 10% of those women will have babies with congenital heart disease. So it doesn't seem like a lot. And, I like to tell the moms there's about a 92% chance of normal of a normal heart, which is pretty reassuring. But if you look at it, since congenital heart disease happens about 8 out of 1,000 live births, 8 out of 100, which is 8%, that's really 10 times the normal population, which is why we recommend getting a fetal ultrasound of the baby's heart during pregnancy. Interestingly, if the dad has heart disease, it's a little harder to study. But if the dad has heart disease, then there's about half of that, so a 3 to 4% chance of the fetus having a heart problem.
Wow, that's incredible. Amazing what we can know now.
Yeah, just a lot of moms don't want to be surprised. I know my wife doesn't want to be
Yes.
surprised. And certainly the doctors, the neonatologists, the OBs, the high-risk OBs, it's good to have everybody ready at delivery if there's going to be a heart baby born. So.
Yeah, no, it's true. I think it's amazing. It's kind of like your budget, right? Like you don't want to know, but once you sit down and you look at everything, it's like, okay, now I've got a plan. Now I can do this. And I think it's the same with health and our baby's health during pregnancy. It can seem so overwhelming, but once you start to get a plan in place and get support in place and find those, resources, because our area is so blessed with so many amazing resources that can support you through that journey. Yeah.
Yeah, I agree. And I really think that the key is to be prepared. And really, a lot of what we do is counseling. We want to counsel the moms and counsel the parents and the family about what to expect. A lot of times we can predict what the heart's going to look like because we have a good diagnosis. But every baby is different. Every pregnancy is different. I think what we want to do is provide really good information and counseling, and then also some real expectations of when the baby's born, what the mom and dad and family can expect. And so that's, at least we want to be able to provide that.
It's so fascinating. So walk us through what happens to the heart during pregnancy. How does that develop just in a regular pregnancy?
Of the mom, for the mom's heart or the baby's heart?
The baby's heart. I guess both.
Yeah, so we'll take the mom's heart. The mom's
Sure.
heart's easy, but I always like to say pregnancy is a stress test. Pregnancy is a stress test. It's a 9-month, 10-month stress test. It starts out kind of easy, but from what I hear, it gets harder at the end. And you gain weight and you gain fluid, and you're pumping, two hearts and 2 bodies instead of just one. So, and maybe more if you have multiple gestations and twins and triplets, right? So it's a stress test, and it's clear, it's normal, by the way. The pregnancy is a normal thing and it's natural. So I also try to tell the moms that this is, women who have been having children for thousands of years, and we're surviving as a species. So we're doing it right, but we try to help them and try to prepare for any problems that could arise during pregnancy, especially if the moms have heart disease. So that's pretty straightforward. And we work really closely with our OB colleagues and our anesthesia colleagues and high risk OB, as well as even fetal colleagues, because there's a lot of fetal doctors, neonatology doctors who can get involved early and to kind of just let us know. I'm focused on the heart, but there's obviously lots of other organs and development that go on of the baby as well. And, most of the time the heart will be essentially pretty much formed by about 8 to 12 weeks. And then the rest of it grows as far as size and muscle mass. But that's when a lot of the cardiac tube, as they say, is formed. And so we continue to follow it, but the heart essentially has 2 functions. It's got a plumbing function, and then it's got an electrical function. So we make sure that those are all working well as the baby progresses during pregnancy.
It's so hard to believe at 8 weeks that, it's amazing to think what's going on inside a mom. It's amazing.
It's really, yeah.
Incredible. Was there anything else that you'd like to share with us?
Yeah, well, Kate, I just wanted to say, we're happy to be on your blog, and we thank you guys all please for the opportunity. And, I think what I want to do, and what I think we want to do as an institution, Phoenix Children's and our partners around the city, is really say, we just would like to be a resource and would like to make sure that we have a lot of opportunities for moms and babies and families to come here and get good care. I like to think that Phoenix Children's is a really great institution and brand. I certainly work with a lot of fantastic doctors and nurses and everybody. And, we want to be able to extend that resource. And what's nice is actually in this era of Zoom, right, just like we're doing now, and so-called telemedicine or telehealth, we are able to do a lot remotely. So safely in a COVID safe distance, online like this, but also being able to counsel, being able to provide convenient appointments for parents and families. And also we've even been able to do some physical exam things as well too. We all have these smart watches now. We can get a lot of information that we couldn't get before, sort of telemedicine took off. But now we can get things like blood pressure, EKGs, oxygen in your bloodstream, blood sugar. So a lot of those so-called vital signs, which are vital and vitally important, we're now able to get those. And to a cardiologist like me, that's really helpful. But we also like talking to patients and moms and parents to see how you're feeling. And, we can look at how things are progressing during pregnancy and just overall health. I think we are definitely in sort of the era of overall health, especially women's health. Let's be honest. Women often will run the household and run the family and run the healthcare in the family. So we know that the moms and the women are vitally important to really kind of making hopefully good healthcare decisions, and we want to be able to help with that.
That's fantastic. And I think a lot of us, I certainly didn't realize that Phoenix Children's is not just the hospital downtown. It is, you guys have so many locations now and things you do for the community. And I love that we're getting that message out to let people know that the presence you guys have and the availability you guys have.
Well, that's a great point, Kate. You're right. Our original building is here, the 51 Freeway, 51 and Thomas, or 51 and 10. But yeah, there's a lot of expansion. A lot of the families and parents and moms are moving east or have moved east. And they're in the sort of Chandler Gilbert area, so-called East Valley. And so we are over there as well. We have a building there, Mercy Gilbert Medical Center, that we've essentially built with dignity. And so we're going to be opening that up very soon. If it wasn't for COVID, we'd be open already, but we obviously got facts the past 18 months, but that's coming. And then we just made an announcement to also build a Phoenix Children's Hospital in the Northwest Valley, kind of in the Arrowhead area. So that'll be coming. That's a couple of years away, but that'll be coming because we know that that Phoenix is expanding. I heard on the recent US Census is that Phoenix is like the fastest growing city in America. I think you and I have clearly seen that. So we're trying to prepare for the growth that's happening in the Valley. And I think it's a great time to be at Phoenix Children's and to work with your group as well.
Thank you so much. Well, thank you so much for being here and taking your day to share this information with our moms. I love that you guys have been Phoenix Children's has been so accessible and just trying to help the community and get great information out to help all of us through the journey of motherhood.
Well, thanks again for the opportunity. It's great to talk with you, and let me know if I can help, but happy to connect with you, and it's been my pleasure.
Thank you.
Yeah.